Hello, everybody, and welcome to Nursing Uncharted. I'm Maggie Reichard, pronouns she, her, and I am your host for this podcast. Thank you so much for listening today, wherever you are listening or watching. We appreciate you coming and taking a listen to us. Be sure to send us your feedback on the episodes through comments or reviews. We read them. I love to read them and tailor future conversations based on that feedback. So leave a review on Apple Podcasts or subscribe to our YouTube channel. Comment on some of the YouTube videos. I love to see those. We have started themes at Nursing Uncharted. We've roped together some guests that all kind of tie into a theme of the future of nursing. We have a couple episodes on, what the future holds for us, how to make nursing school more accessible, how to set ourselves up for future success financially, and just building resiliency within the profession for nurse educators and nursing students. So stay tuned to what we have in store for the next couple of weeks. This episode is sponsored by AMN Passport. AMN Passport is a highly rated app that AMN has created for travel nurses or prospective travelers, where you can find assignments, book assignments, and manage everything all from your phone, which puts you in the fast track to your next travel job. You receive instant job match notifications on your phone when you download AMN Passport. So if you're interested in travel assignments, be sure to check that out. So today we have a nurse educator who has been in the field for 30 years. 15 of those years she's been in nurse education. She started in business administration and finances and then moved into the nursing realm. She got her BSN and then her MSN and then her Ph.D. in nursing education. And she's also dabbled a little bit in nursing informatics. So we're actually going to do a bonus episode a couple days after this comes out, just all about nursing informatics and technology in our industry. But for now, we are talking about the future of nursing with Maria Grandinetti. Maria, welcome to the show.
Thank you so much, Maggie. Thank you for your kind welcome.
Yeah, absolutely. So I want to know, what inspired you to become a nursing professor, and, what have you enjoyed the most about teaching nursing students?
I could recall back when I first had an aha moment about being a nurse educator, and I was working labor and delivery, and I worked night shift, and I saw a flyer that was on the nurse's desk, and it was from a local university and having a relationship with the hospital and offering courses in nursing education. And I always felt like I should be a nursing educator because I always gravitated towards newer people. I always found a lot of enjoyment in orienting new nurses. Yeah. And I really found it to be very rewarding. So that's when I started on a part-time basis to complete my my master's degree. And then while I was a faculty member, I returned back to school for my Ph.D. I just love nursing education because it allows me to be in nursing and share in narration all my experiences as a nurse educator. I just love supporting our profession and seeing people go into nursing.
Yeah. I think that it's really important to, have somebody that cares so much about the profession decide to go into education and start to train and teach these new batches of nurses every semester. I think it's really important to have, energized, motivated nurse educators,
And that's what, I would never I never ask my students to be anything that I'm not. So I want them to be curious and motivated, and I do the same for them. So I always meet them halfway. I'm their partners, I'm their cheerleaders, and I always tell the students that I want to see them to be successful in nursing.
Yeah. Do you feel like that kind of relationship, conversational, tone, having a rapport with the students, that serves you well and serves the students well?
I sure do, because when I have that relationship, it's similar to a bedside nurse. They have a really good relationship with the patient. There's more trust
Yeah.
confidence, and there's more opening up. And I feel the same way with students, and it makes me more approachable. They come to me, they
Yeah.
ask me questions, and things get resolved or they get clarified. And then they're rather than going to their peers and asking a question, it's great when they come to me and find the right answer. So I always, I always strive to have a really good relationship with my students.
Yeah. It's actually funny. I have to tell you, before, we had talked to you yesterday before this episode, I had Googled you and I found your Rate My Professor, and you're rated very high on Rate My Professor.
Thanks,
Like your
Maggie.
students really just what you said, like maintaining that relationship and allowing trust there. I mean, it seems like that's definitely reflected in the way that your students see you.
Well, we want to educate these individuals. We want them to be professional, and we want to, they already have, if they're in nursing, they already have a sense of caring for other human beings.
Yeah.
So, and that's what I hope to show them,
Yeah.
that professionalism, that caring, and so they could pass that on to their patients.
Yeah. That is really important because I think, one of the biggest things when nurses start out, they're very task oriented and they kind of lose the humanity of nursing a little bit. And I think having professors that consistently, remind them of that through the way that they teach, and instead of just, maintaining a objective relationship, I'm sure that helps them remember the caring aspects. Like your professors are caring for you in the same way, you can establish those relationships with your patients and continue that humanity piece.
Right. You're so right. And it's beyond just skills. Nursing is beyond skills. So we,
Yeah.
we introduce, we put a lot of skills, early nursing in the first clinical course. But then we try to really discuss the scope of practice with a nurse and, the increasing responsibilities of a nurse.
Yeah. Yeah. I remember just looking back into I think I've talked about this before in a previous episode, where some of those subjective courses, it's been a while since I was in nursing school, but therapeutic communication or the art of nursing, it's these kind of subjective topics that I didn't really hit really hard in studying those things, but it's so important now being a nurse. That's such a big piece of it that I think gets lost in all of the, critical thinking, technical stuff that you have to know. It's really, you need both. And I think that art and therapeutic communication and all of that kind of gets lost sometimes in the field.
Right. It's even the simple things. It's the body language, for example. You're speaking with the patient, even though you have this eye-to-eye contact and communication with them. It's the crossing of the arms, or it's standing above them rather than, alongside them. It really makes a difference. It makes the patient feel, that you're listening to them. So talk about that.
It does away with kind of this hierarchy or this, roles where, it has to be kind of a two-way street in order to enable that trust.
Absolutely. The trust is so important.
Yeah. So what sort of things do you think, looking over your career, what are some big things that you've learned as a nurse educator? Can you give me some pearls of wisdom for our nurse educators listening or those considering nurse education?
I'd love to see more individuals go into nursing education. I would more diverse individuals, and more men, and just we need more of that, just like we have that in nursing. We like to mirror the patients who we care for. We like to mirror the students in who we teach. So I cannot imagine being anything else besides a nurse educator. And it's just, I'm so drawn to it. But that is within me, and that's my passion as well. But I would say to a lot of people, think about nursing education and think about the possibility of you teaching future nurses, because it's it's so rewarding. It's just when
Yeah.
you hear and see the direction they go to after graduation and they communicate that back to you, it's
Yeah.
really a wonderful job in nursing.
Yeah. We were talking about this yesterday, I think a little bit about like a closed loop of communication or a, full circle moment that you can have as a nurse educator where, in the hospital, you take care of somebody and, once they get better, they leave and you never really hear how they're doing again. And as a nurse educator, it's kind of nice that sometimes, you teach these people and then they will come back to you sometimes, or, you can see the fruits of your labor in that way.
Right, right. I mean, we may see them in our graduate program, which is really great. We see them again. It could be years later. I could be chairing their doctoral dissertation, which is really wonderful. I have just seen so many things that are different and advanced over the past 15 years. We used to have paper exams. We used to I remember when I took my NCLEX, it was like the last year in which we took it by paper, and it was over
Oh,
two
wow.
days. And I tell my students that. and, and
Oh my
but things have
gosh.
evolved so much. Like testing is all, on your computer, and things are more, available using
Yeah.
technology. So it's been really wonderful, the improvements in nursing education.
Are you interested in taking your nursing career to the next level? B.E. Smith, an AMN healthcare company, is looking for qualified nurses to fill exclusive interim unit supervisor roles. This could be the travel opportunity you've been looking for, so apply now while positions are available. Click the link in the description box to contact a recruiter today. What ways? Technology certainly has evolved immensely. What about like the ways that you teach? Like, when you started, do you feel like it's different in the ways that when you started nurse education 15 years ago, did you teach differently then than you teach now?
I think the students are different, and I
Hmm.
think I adjust to that. And we go through generations, and I think
Yeah.
I think the needs of students are different than 15 years ago. And I think the
Okay.
pandemic certainly has impacted the students as well.
Yeah.
So we have to be nimble with that. We really have to be understanding of the student and where they are, because there are students that may need to work full time, or
Yeah.
that they didn't have to 15 years ago. And
Mm.
we really, at our university, we really want those first generation students. We want them to come to our university. We draw in those students, which is really great. I think that
Mm.
their mental health is important. Their responsibilities at home.
Sure.
There's all different types of ways in which people learn best. So as a nurse educator, you need to be
Yeah.
understanding of that, and communicate the content and the information in a way that captures all students.
Yeah. Do you feel like that has that kind of, honing in on the student themselves and how they best, how they're able to best succeed? Do you feel like that is a value now that wasn't a value 15 years ago?
I think it's more focused on those things and more
Sure.
appreciation of that, and then modifying my teaching for each and every student so they
Gotcha.
learn best. So I'm always interested in best teaching practices and best ways that students learn, and it could be varied in the classroom setting, online teaching, in the
Sure.
clinical setting. So I've done all of those things in rapid pace programs, in our accelerated baccalaureate nursing program, which is a 1 year
Hmm.
program, our traditional program, it's and our graduate program. So there's and those who are in our graduate program, they have a lot of responsibility. Oftentimes, they have family, they may have children,
Yeah.
they work full time, and so it's modifying the way we teach so
Yeah.
we could accommodate the students, and we want
Right.
to retain our students and have them learn best.
Yeah. Yeah, I feel like there's probably, can't speak to nursing school now, but I assume that, the expectation on students to succeed while also having these other expectations in their life. I think that it's probably contributing to like a sense of burnout, I'm sure, or like stress on nursing students that didn't used to. I'm sure that, expectations are probably different now than they used to be.
You're so right, Maggie. I mean, it's so different. And again, since 2020, it's really been more clear and that we need to be understanding of those things.
Yeah. How did COVID, impact nursing education for you in your experience?
Well, my experience was more senior faculty because on average, nurse educators are around 50, 55. That's the average age of a nurse educator. It's often a later decision by individuals and become a faculty member.
Yeah.
So we saw more senior faculty that were closer to retirement. We saw them take an early retirement. And when we lose someone like that to retirement, we lose a lot of knowledge and experience. And we, and then we have new nurse educators, which is really great. But I think the limitation also since 2020, so we lost more of those senior nurse educators. The nursing students were limited or prohibited to enter in the clinical setting, acute care setting. And I'm understanding of that because of the pandemic. So they lost those experiences. We try to replace them with virtual simulation patient, we have a lot of resources with that. But as you know, there's nothing more than having face-to-face patient care for best learning. And we really need to advance our nurses to care for, more aging population. And we have people living longer and they have more chronic illnesses and they're more complex patients. So we want to hold the bar high for them. Yeah. And so it's a balancing, but we're still trying to figure it out.
Yeah. What do you think has stuck now, now that we're kind of, we've kind of normalized, and I feel like, it was probably, it shook a lot of nursing programs, COVID did, everywhere, and you needed to find your footing. So what do you think has stuck since then? Like, do you still do online classes, or like, what kind of has changed and you think is probably going to stay that way?
Well, to be honest with you, the traditional students really were so happy, or they were so happy to come back face to face and have clinical and be in the classroom. And to be honest, the students have communicated to me that they've learned best by being in the classroom amongst their peers, being able to ask questions, have their answers, and really collaborate. I mean, there's something about being in the classroom for that traditional each student that they really enjoy. No masks, no distancing, able to go to clinical and not replacing classes with any kind of recordings or Zoom meetings, or it's been really great, and they have really appreciated it as well.
Yeah. Oh, I'm sure. I think that I'm definitely a more hands-on learner, and I can't imagine, trying to do things feeling confident in doing things over a screen,
Right. We can only, imagine how we're trying to demonstrate a skill over, Zoom. I mean,
this little piece, you click that on and draw medication up like this. Go get a knife or, I don't know.
Well, we give them a kit, that they picked up at the school, safety,
okay.
and then we, like kids some things, but we demonstrate them like, okay, take the needle, draw back the air, and wipe the syringe. Write the cap of the medication, and it's just water, but and it's so they could practice, but there's something about teaching a blood pressure in person than by Zoom. So we're so thrilled, and I know a lot of nursing professors and students are really thrilled to be back in the classroom because that's where learning is highlighted.
Yeah. Do you feel like a lot of the nursing professors that ended up going into retirement early, was it all of the changes, or like moving all online? And because I know that was a huge change for, nurse educators. We've talked a lot about how nursing students were shook in the nursing programs, but for nurse educators too. I mean, that was a huge, change in the way that they taught students.
Right, right. I mean, and technology is intimidating, and it doesn't
Yeah.
come easy to some people. And we saw that with the older faculty members, or more seasoned one. I don't really even like to say older; I say more seasoned.
Yeah.
And also that fear of contracting COVID on campus, or
Yeah.
when we did come
Yeah.
back with masks, there was still that sense of fear and
Sure.
hesitancy, and it's, we have a lot of young people. And so we had
Right.
COVID, it threw just like any other campus. And so I think it was moving everything and going
Yeah.
more advanced and using that technology and that fear of contracting the virus that really there was some hesitancy to return to their
Yeah.
position.
Absolutely. What are some other challenges that you think nurse educators face today that, may have been different? And how can we support nurse educators, I guess, for the future?
I think the challenges are, I think, preparing our students that's one thing. Over the past year and a half, we've been trying to prepare our students for the new NCLEX, next generation NCLEX.
Mm,
And that has changed the way we teach. We need to, because it's all about critical thinking and clinical decision making. And we want them
okay.
to be advanced with that.
Yeah.
And that's what the NCLEX NGN is going to do, is going to test for
Okay.
that, for their readiness for practice.
Sure.
So it's changing ways in which we teach and test in our assessments to include these unfolding case studies, or
Okay.
more select all that apply, these drag and drops,
Mm,
and we're fortunate to have a testing platform that allows us to design our questions in that manner,
okay.
and which is good because we try to mimic the NCLEX. So it's
Okay.
been we've been in the works with that. Also in nursing education, I mentioned that how the students are a little bit more complex, having more complex needs, and I'm being
Mm,
more understanding and accommodating to them, but also
yeah.
holding that bar high, that we want them to be ready. Not only, we want them to be ready for practice, to take the NCLEX, pass it the first time, and to
Yeah.
pass the program too. So we have a lot of responsibility, and that's why I see myself as a nurse educator, as having this responsibility to teach this profession and to teach it the best way
Yeah.
I can.
Yeah. I want to go back into next gen NCLEX because it is, so I've heard it's this monumental change, that has, changed the way that tests are taken. So, like, go back into that a little bit. How did the NCLEX used to be set up, and how is it changing to be next gen? And, like, what's a question that was like, traditional NCLEX question that's now going to be, formed into like fitting this new way of setting up questions?
So, as of April 1st of 2023, the next generation NCLEX will be launched. And I know they
Okay.
have been doing a lot of beta testing, the National Council of
Mm,
State Boards of Nursing, this spring and in the fall as well, in preparation. There will
okay.
still be some questions that they're going to be beta testing, similar to the previous NCLEX, where there was a minimum
Right.
of 70 questions, and there was about 10 or 15 of those beta questions.
Sure.
Um, it is similar. So then that minimum is going to be the 70 weighted. So it's still
Mm,
adaptive testing. The test only goes up to, I think it's about 145 questions. It's five
okay.
hours rather than 6 hours. But the types of questions, so there could be up to 3 unfolding case studies, and each case study would have 6
Mm,
connected questions.
okay.
And then there are other alternate style questions. There were select all that apply. Previously on the NCLEX, there were dosage calculation questions. Those are going
Right.
to remain. But one
Okay.
great thing with the select all that apply is that the the person who tests will receive partial credit on that select all and apply. So
Oh,
that
that's
gives
good.
them, a little bit of an advantage, a little boost, right? There's not
Yeah.
just automatically, you answer one answer option incorrect. You have the other ones correct. And it's rather than getting the full question wrong, that you did get partial credit for that. So that's giving
Yeah.
credit to the tester, which is good. There's other alternate style questions, and there's drop downs, there's drag and drops, there are prioritizations, there's
Okay.
these there is bow tie, there, just kind of putting everything together to really assess their understanding of thinking and what would they do, what would their decisions be when they care for a particular patient, which
Okay.
I think it's wonderful. And I have to
Yeah.
say is that the National Council State Board of Nursing offers so many resources to those who are testing and those who are teaching, so nurse educators as well as students, that regarding the NCLEX NGM.
Okay. Yeah, I was going to ask, what's the uh, mentality, or what's the perspective from nurse educators? Do they like this change? Is it, intimidating, or, like what do you and your other professors think about it?
I mean, we appreciate that they are assessing this, and we have
Yeah.
we're able to prepare our students for, actual patients that they're going to be caring for with these complex needs. And
Yeah.
so we really appreciate that, and the need is there. There's just so many uncertainties, like we're not sure how, until this exam
Yeah.
unfolds and it launches, and we'll see what the results are. And we're excited about it. We think it's a positive thing, and it advances our profession as well.
Yeah. I mean, certainly, I think coming out of an era of nursing where nurses didn't feel prepared so much because of COVID, because of, doing things online, changing up this way of teaching to be more critically thinking based, or, simulation, situational case study based. I'm sure that probably helps them feel a little more prepared, you
Okay.
know, I'm sure that's probably a change that was identified in the last couple of years, a problem that was
Yes.
identified that, you know, we have to
Right.
start focusing towards, you know.
Right. I think that we have a lot of people who need care, and we need really smart nurses. We need safe and
Yeah.
good decision makers, and know what to do and to recognize the early cues of a problem. So we are with them, 24/7 in acute care settings and chronic care settings, and we are with
Yeah.
them. So we need to see this in our patients.
Yeah, absolutely. And I think you've touched a couple times on how, patients are at a higher acuity now more so than other times, And I guess that's probably because, we're just looking into things more. We're more involved in everything about the patient and seeing the patient as a combination of all these if different factors, I guess. Would you agree? Like, at what is making some of these patients like higher acuity patients now more so than ever?
You're right, Maggie. I mean, we have better medication. We have earlier tests to diagnose. We have better treatments. We have
Yeah.
our baby boomers who are in need of this, who are a little bit older now, and their need. And again, I mean, it's managing these complex patients that have a number of to have acute or chronic illnesses, and then people are living longer. And so I would agree with it. I mean, it's great that healthcare has evolved and improved and has the ability to extend life, which is
Yeah.
great, but there's this need to be prepared for that.
Yeah. Yeah. Absolutely. Do you feel like nurse educators, or do you feel a sense of responsibility to, let build resiliency within your nursing students in preparation for going into the hospital? Because there is, that's a big, hot topic in healthcare, is nurses kind of, leaving the bedside because they're burned out for these other all these different things why nurses are leaving. Like, do you feel a responsibility to build resiliency within your nurses?
Yes, I mean, that begins in nursing education. Building
Yeah.
that resilience, absolutely, and adaptability, and having flexibility, and
Mm-hmm.
because you know how it is in nursing practice. I mean, it's very unpredictable at times, and you really need to be prepared for that. So we try to prepare them in nursing education for practice. We also prepare them to give to others beyond their professional position, and give to the community. So community service is always part of our program. So every single semester, we ask students to participate in some sort of giving and volunteering in the community. And we hope that crosses over in when they become registered nurses, that they continue to practice that well, because that's who we are. We're caring individuals, so not only in our practice role and our professional,
Yeah.
life as well.
I really like that. I don't know if my program did. I mean, we had community health nursing, but I don't think that there was a point of, doing community service every semester. That's another way I'm sure that helps, just tie all of their studies and teaching kind of back to the humanity of nursing, like keeping the focus on, it's not just about books and, critical thinking. It's about seeing people as a whole and doing things for your community.
You're absolutely right. I mean, most nurses in the United States work in acute care settings, but it's great for them to see outside of that. And oftentimes we have clinical and acute care settings. We do have it in chronic care settings, and we have population health as well.
Yeah.
But the more you see, the more you're understanding. And even screening events, I mean, in wellness, and that's one of the spheres of care. I mean, really preventative care. So we're not only at that point, we're trying to manage chronic problems or, providing palliative care, but we want to see that wellness of it as well. And that's an important part of nursing.
Yeah, absolutely. I think that's great that that's being taught in nursing school, because I think that preventative care, I'm hopeful that, we will maybe move towards an emphasis on preventative care, in more of the forefront, as opposed to, this is the problem already, we need to fix it after the fact. It's nice that we learn that in nursing school too. Like, yes, these can be your, patients, that you have to know how to fix all these problems, but it's also very important to prevent these problems from happening.
Right, absolutely. I mean, it is our scope of practice to do that.
Yeah.
And that's what we are as nurses. And we look at all things, not only the patient, we look at their social, how does, their connectedness to other people, their environment, has the air quality, the water quality, do they have friends, all of that impacts their health. So, where do they live? Who do they live with? Do they have access to care? Do they have insurance? Do they, have ability to eat healthy foods? So it's much broader than other health professions. At least it's more, it looks not beyond just the patient. That's our main focus, but we look at other factors as well that can impact health.
Absolutely. That just reminded me of like epidemiology. I feel like there was a class on it. Do you have a class on epidemiology, or is it kind of roped into community health?
It is. And we do have it throughout the curriculum as well, but we start with pathophysiology.
Sure. Okay. Yeah, I always was interested in that in nursing school. I thought that was a really, cool avenue of nursing, to be like, okay, 5 people have come in with this type of, illness. Let's check the water quality of like this community area. I just, thought that was such a cool way to kind of implement nursing into this like outside scope of, not just in the hospital, but out into the community.
And we do have a course in our program. It's environmental sciences or environmental health. And it's important for nurses to know that, because it talks about the community and what impacts health. So living in a city or a rural area, and it's, there's different factors involved in that.
Yeah. How I want to go back to kind of nursing education and how it's changed and where do you think where it's going? Um, how do you think in your nursing program? I know you can only speak from your experience, but how does change happen normally in nursing education? Does it normally come from, having a team of educators that embrace change, or is it normally, maybe it's a little of both, but is it normally like from a top down, like department head says, this is a problem and we're going to change it this way?
Right.
Is it a little of both?
Right. Well, we need to include certain things within our curriculum, and that's all nursing programs do. Like more recently, within the past 5 years, we need to include more diversity, equity, inclusion. We need to include more information about nursing informatics and technology, and because
Mm-hmm.
we need to advance our profession and our education. So
Yeah.
that has definitely changed. Some things that I find interesting and just on the forefront is artificial intelligence. I'm sure there's a lot of things in the news and a lot of things I'm reading about, and there's really a lot of uncertainty about it. They have these things that, artificial intelligence that could help the student write a paper or complete an exam. And it's just so it's odd to me because we've never had those, that in the past in education.
Yeah.
And right. And but then there's tools that are going to combat that. And, it's just, to try
Yeah.
to detect it. So it's technology is great because it is part of healthcare, and we're
Mm-hmm.
using it more and more and in the settings and the practice settings. But in education, it's really useful for students because they could access different resources, and which is really wonderful, and using
Mm-hmm.
technology. However, there's other technology that maybe is less desirable.
Yeah, I heard about that, like Chat GPT or, people just typing in their prompt and then that coming
All of a
up
sudden, a
with,
paper comes up. Yes.
yeah, right. Yeah, how like you said there are programs to kind of identify that and be able to combat it.
There already are some already, but I haven't seen any of that. But we do have other things that kind of cover, we want all our nursing students to be ethical and honest and
Yeah.
um, be, so we have, we have things to kind of watch over things. So we have Turn It In. I don't know if you're familiar with that. It's like you turn in your
Mm.
paper and it's a similarity checker to published work.
Oh,
So
okay.
it makes sure that their paper is mostly based upon what they know and showing what they know. And then I always say like the citation should support what you say, so what you've learned. So
Yeah, yeah.
it's rather than get the majority of the content be more of other people's words. We want the majority of their work and written assignments to be their words.
Yeah.
So we
Sure.
have that in place. So they submit it and they have an acceptable score, which is makes things a lot easier for the nurse educator and for the student
Mm-hmm.
too. And they realize that.
Yeah. So you feel like it's probably, when change comes into the program, it's kind of like a problem solution type, like you
Yes.
saw this, AI model and like, okay, like, now we need to pivot and, adjust
Yes.
our program based on what we're seeing.
Yes, yes. So we are in wait. So AI is really great. Like we looked into. It's a little costly, so I'm hoping that over time that it'll be more affordable. Is that the headsets, and I think they're really great to simulate patient situations, and I think they're so interesting and so incredible that we could use it. How we could test students or assess students' knowledge when they're caring for a
Yeah.
patient. So I think they're really amazing.
Mm.
There has to definitely be a higher budget for that to have a number of headsets, not only to purchase them, but to maintain them and repair them and
Yeah, yeah.
update them also with any kind of technology. So that takes some funding.
Sure.
I think that students are, that they wouldn't go into nursing because oftentimes, let me just go back a little bit. Students often come into nursing because they may have had a family member or mother, father, aunt, or uncle, or good friends that went into nursing. But oftentimes we see people go into nursing because they've had experience with their own health or their parents' health or grandparents, and they're part of it, and they see the role of a nurse. And that's oftentimes where people go into the profession, is when they see the profession. But younger people oftentimes do not see that, or they don't have any family members. They may not think about nursing. So I say to people that, look into, like, and speak to nurses if you're interested in nursing, because it's, as nurse educators, we want to draw in people who have that equal passion as we do.
Yeah, absolutely. And I think that's probably, one of the most important parts about being a nurse educator too, is like instilling that passion, or letting, helping people, reminding people of that passion by the way that you teach and the relationships that you have with students.
Yes. I mean, and it's never too early also, even with nurse educators. I mean, I tell my students it's never too early to begin studying the NCLEX. I say you could start studying the first day of nursing school to prepare for this final test.
Yeah.
So start early. I mean, save your books. Don't rent them. Like, even purchase them pre-owned. It's fine. But have your books so you have them readily available to study for the NCLEX. And I encourage them, as a nurse educator, encourage them to keep their notes. Don't throw out anything. Don't get rid of your books. Don't sell them. Wait until you graduate and you pass the NCLEX. Then you could go ahead and pass them on to maybe someone else who's in the program, or, bring to the clinical setting as references.
Yeah.
So that's how I guide them.
I used to still have I had my nursing books for a long time. I even bought a couple pharmacology books later on, because, that's like a topic where you cram and you learn so much in nursing school. And then when you apply it, years later, and you're like, man, I wish I would, like, I want to take another class on pharmacology now that I'm 9 years in, just to remember some of those, like, pharmacokinetics. So keep your books. That's it.
Yes, keep your books. It's funny because I speak to a lot of nurse educators and nurses, and they do keep they end up not giving away. They're like sentimental to them, these books. And believe it or not, I have a lot of books from my nursing program. When I went to Seton Hall University, and that's where I got my nursing degree, is that I still have those, and they're on my bookshelf from the lower level, and I don't open them, but they're part of me. They're part of my journey. And I feel like they're part, not only as a nurse, but a nurse educator as well. So I love books. I always appreciate, the hard-covered books or the soft-covered books. And I really, I love reading, and I love all of that. So.
Yeah. Oh. Well, I want to, end this episode with maybe some resources that you've used, or that you know of. If a nurse educator is seeing a problem in their program and they want to see how other programs are doing things, like, are there resources that you know of that can help them? Are there resources that help nurse educators, like, stay up to date with developments in nursing education?
So a couple of things. I always, I ask my students to look at the literature, look at the research, look at evidence-based practice. So nurse educators should do the very same. They should be most up to date. If we're asking our students to do it, then we should do that ourselves. So read journals, read educational journals and articles and new research on best teaching practices. Yeah. And we ask our students to do that within the curriculum, in hopes that they'll continue to do that even in their practice area. So they decide to become a pediatric nurse or an obstetric nurse, then we want them to go to those journals and keep up to date with the most recent information. And so I love nursing research as well, and love to carry that out. So it's such an important part to discover new evidence that we could pass over to practice. Yeah. There's one resource that is really highlighted student success. UWorld is a resource that we use with our traditional accelerated nursing students. It is it's adaptive testing, and there's self-assessments, and there's a learning platform for faculty to use in the classroom, like pull up some questions and great rationales, pictures and descriptions, and really shows the student as they approach graduation, it predicts the likelihood that they're going to pass on the NCLEX, and it gives them a boost of confidence and nurse faculty and nurse educators can see, well, this student is really on track. They're doing a great job using this product. So we really love that product.
Okay.
It helps not only faculty, but it also helps the students see their readiness to test.
Sure.
So
Probably helps with, just build confidence in the nursing students that they can, they can achieve this. It's a daunting test, but you can do it. And as long as you, practice and do your test, it's a large test bank, is it not? That's what UWorld is.
It is. It's it's over 2,000 practice questions, and there's all next generation questions as well. But it really puts you, but the more you use it, the more predictive it is of your success, and it could put you on we want it to be high or very high likelihood or probability of passing the NCLEX, and I have students come back and say, you know what, Dr. Grandinetti, I saw questions that were very similar to UWorld's, which was really great. So we continue to use that product.
Oh, that's good. Well, I hope that it continues to build, nurses that feel confident and, ready to take that next step and become nurses.
Yes. I mean, I would just love more people to think about nursing education. Think about going into becoming a nurse. And enrolling in nursing programs and joining our profession, because it's a wonderful profession, right? Can you imagine being anything else, Maggie? Can you?
A lot of people go into it because it's a calling. There's something about it that people know that it's something that they can do, and so it's heartbreaking to come into the profession and then a couple years down the road feeling like it's not what they had intended, or it's not something that they it's different than what they had imagined.
Right.
And so setting people up for success in nursing school and being a good educator, I think is, one of the building blocks of creating this next generation of nurses that are going to stay.
Right. And then, resilience and really, adaptability and flexibility. And, that caring part is within someone, right? So,
yeah.
And I would love to see more people going to become nurse educators. So I'd love to see more nurses. We're always at a shortage, right? I love to see more people going and considering the profession of nursing education.
Yeah. Awesome. Well, Maria, thank you so much for coming on and talking with me about the future of nursing today. And if anybody is interested in nursing informatics, we are going to have a bonus episode after this. It'll air a couple days after this episode comes out, all about kind of the technology, future of technology and what it has in store, what we already have, what are some of the accomplishments in technology so far. Telehealth is a big topic, so be sure to check that out as well. But for now, Maria, thank you so much for coming on.
You're very welcome, Maggie. Thank you.
That brings us to the end of the show. Thanks for tuning in to Nursing Uncharted. To learn more about today's episode, make sure to explore the show notes at americanmobile.com/nursinguncharted. And don't forget to subscribe so you never miss a guest. If you're a nurse interested in traveling, visit americanmobile.com to explore the largest database of travel nursing jobs in the industry and the amazing benefits that American Mobile has to offer. Also, a special thanks to producer Jonathan Carey, assistant producers Katie Schraubman and Sam McKay, and Aiden Dykes for the music and editing. Until next time, take care of yourself.